Hello and welcome to a special episode of Be Well with MS Podcast. I'm your host, Dr. Agne Straukiene, and today we are celebrating International Women's Day with a very special topic, the women's journey, navigating menopause and beyond. My beautiful ladies, today we are diving into the heart of womanhood, celebrating the incredible journey our bodies and spirits undergo. It's an episode dedicated to you, to us, to the beautiful dance of hormones that changes as we navigate through life. We are going to explore what it's like being a woman in all our complexity and strength, with a particular focus on a phase that marks both an end and a beginning, menopause. It's more than just a biological process. It's a testament to the resilience, the grace, and the power that lie within each of us. Join us as we unravel the mysteries of menopause, learn to embrace the changes it brings, and find ways to support our health and well-being during this significant time. Together, let's celebrate the beauty of being a woman at every stage of our lives. So grab your favorite cup of tea, make yourself comfortable, and let's begin this journey together. Here to us, to our health, and to the endless beauty of womanhood. I cannot wait to introduce you to remarkable guests, Dr. Katie Lambert, a GP in South Devon with a deep expertise in women's health and menopause, and Dr. Kirsty Gillies, a GP in East Devon with a special focus on menopause care. Both are passionate educators and advocates for women's health. I'm thrilled to have them here to share their knowledge and experiences. So welcome to this episode, Katie and Kirsty.
Thank you very much, Agne.
Well, I think we should start our conversation, which we are not going to share any guidelines here. We are not going to prescribe any medicine here. We're not going to personalize your pathway and care and management, but we would like to just enhance the knowledge about the menopause and living with it, being a woman, experiencing that shift of the hormone and changes in our lives. And I think it would be, first of all, to have a good understanding what the menopause is. And Katie, maybe you could tell us about what the menopause is and why it is a significant phase in a woman's life.
Yeah, thank you, Agne. So the word menopause means final period. And to understand that final period, that menopause, we need to understand really our normal menstrual cycle, our normal period. So in normal cycles, our ovaries produce eggs each month, and an egg cell develops, it's released. It might be fertilized if there's a chance of pregnancy. And as part of that cycle, our ovaries and egg produce two really important hormones, estrogen and progesterone. These hormones will cause the lining of the womb to be stimulated and then shed in the absence of pregnancy, which is our period. And as our ovaries run out of egg cells, they become less able to produce these hormones. The lining of the womb will stay thin and the periods eventually stop. And so the menopause, that final period, is a sign that our ovaries have stopped working. Now, these hormones, the estrogen and progesterone, they play a multifaceted role in cell growth, function throughout our body. It's not just about the control of our cycles. And they're fluctuating and reducing levels over time can lead to many different and varied symptoms. I wanted to touch a bit on perimenopause, which is the transition phase in the run-up to the menopause. Mm-hmm. And that's a time really when the ovaries are going a bit awry. There's a bit of a roller coaster of hormones. So we can have fluctuations in the function of the ovaries, and we might have a few months where things are beginning to spread out. We might skip a period. Our cycles might come closer together. We might have heavier bleeding, or we might have lighter cycles. And we might be getting some of the symptoms that are a reflection of our low estrogen state. But it can be quite fluctuant. It can come and go.
Interesting. So it's a great shift at the chemical, at the molecular level. So
absolutely.
Of course, our bodies are going to be affected, whether we want that or not. We're just finding the way how to navigate. And I just wonder, I don't know, maybe Kirsty, what are the commonest symptoms of menopause that women should be aware of and what to look out? You know, how should I know I am menopausal or premenopausal? What are their sort of main symptoms?
Yeah, great question. I would say that, I mean, clearly we've got common symptoms that I think as a kind of population we expect, which is a change in periods. And I would say hot flushes are the other thing that are most commonly discussed. We definitely have impact on mood. There's definitely impact on sleep. There's potentially reduction in libido, vaginal dryness, urinary symptoms. I mean, the list goes on. And I think in total, there's about 52 to 54 symptoms that can be attributed to the menopause. Now, clearly not everybody gets those. And clearly they affect women in a totally different way. Some may be more severe than others. And I think, age as well is a key thing. At what points do these symptoms come on? And again, I think classically, we're taught that it's 45 to 55 you see these symptoms coming on, because that's the sort of age that menopause occurs. But actually, in practice, we sometimes see this coming on earlier in women, sometimes from their late 30s. And likewise, the symptoms can continue, particularly flushing and mood disturbance can continue for longer. And I think if at any point women feel that it might be menopausal, say they're flushing, their mood has deteriorated, particularly around overwhelm and anxiety, which they've maybe never had before, that actually they need to be thinking, I wonder if this might be the perimenopause.
Okay. I think a lot of, just listening to you, I think a lot of symptoms overlap with multiple sclerosis symptoms.
Yeah.
It's a lot of discomfort, and some people take some medicine that can cause hot flushes. So it becomes really challenging, what I see in my clinics, to distinguish whether it's a menopause or it's a direct side effect that comes from the medicine that people with MS and women with MS take. So it's really challenging sometimes to pin down. I guess for women, it's important to keep maybe diaries before they go to see the specialists, menopause specialists, and perhaps, and discussing that with the MS specialists and trying to distinguish which are the symptoms that are more to do with their menopause directly, or which are more to do with MS. And sometimes, as I see people, women in my clinics, sometimes even for me, it's very difficult to pin down and say, oh, this is menopause, this is to do with MS. But clearly there is an overlap, and we have to be aware of that, perhaps. And I wonder, is this menopause a sort of a natural process, or it's been influenced by genetics, by environment, by stresses in our lives? Like when women start having menopause, I wonder if there's sort of as we covered the age 40s and onwards, and some women have a premature menopause, and is it driven by genetics, or just that's sort of how the biology is underlying in human being and women that would sort of cause premature menopause?
You're right to bring up the premature menopause, Agne. Particularly, actually, it's more common than people realise. So below the age of 40, about 1 in 100 people will go into an early menopause. And below the age of 30, it's 1 in 1,000. Wow. I think you're right that there is a large amount of this will be genetic related. So how our body responds and goes into a menopause will be related to environmental exposures, but is generally related to our genetics. Things like smoking, if we're a smoker, that we do tend to go into a slightly early menopause. We're talking months to year rather than a significant period of time. I think your flagging up of the crossover between the MS and the menopause symptoms is really important. And a lot of the literature around menopause and MS talk about making sure that there is an awareness in women, and anticipatory guidance, I think, was the words that we used. That empowerment to understand what is happening potentially to our bodies over that time period, and being able to take back some of that control. Exactly as you said, a diary, being able to try and pick apart the symptoms between yourselves as individuals, but also the healthcare professionals, is really useful.
I guess we have to, as women, we have to normalize this process of our body to start with. Acceptance gives that sort of a huge amount of the resilience, and you can cope better once you accept this is a natural flow. This is a natural biology. This is what we do. We are women. We bring up children into this life, and we go through the phases and stages, and this is normal. So we really want to sort of normalize that shift and that sort of a womanhood period, which is, as I said at the beginning, it's the beginning and end at the same time. So one phase starts, the other one stops. So I wonder, Kirsty, in your experience, what are some common misconceptions about the menopause?
So I think there are several. I think you highlight one particularly by saying that it's common. Everybody will go through it as long as you reach your menopause. 100% of women will go through the menopause. And I think one of the common misconceptions is that it's going to be easy for everybody. And we know that that is not the case. There are lots of women who do have a kind of fairly easy menopause, but likewise, there are lots and lots of women who really, really struggle with symptoms. And again, I think it is key that if you are struggling with worsening symptoms, you seek help. And ideally, that's through your GP. I think there's a lot to be said for trial of treatment when it comes to HRT. So there isn't a blood test. We get lots of women who come in and say, can we have a blood test to see if we're going through the menopause? Actually, if you're really in practice, if you're kind of over 40, your periods are normal, but you're feeling hot and sweaty, and we wonder if it is a perimenopause, then a trial of treatment for 3 months with HRT, if you can have it, would be entirely reasonable. And if you feel better on it, you've probably got your answer. And I think very much for your MS population, that difference between actually, is it MS or is it menopause or is it an overlap of both? Actually, sometimes just offering a trial of treatment can be helpful. But I appreciate that your kind of GP that works within primary care, seeing lots of different conditions and, isn't necessarily a specialist or somebody that's done a lot of menopause work, may feel uncomfortable initiating that. And I think that's where that interface between primary and secondary care is so vital, that actually from neurology specialists, you're happy for people to trial HRT. And I think it's really opening up the discussion, and that sort of kind of education and dialogue helps bust a lot of myths. There are, as I said, quite a lot of myths out there. I addressed one earlier, that menopausal symptoms only occur when your periods change. That's not true. They clearly do change kind of before your periods may change. And one of the things I tend to see in younger women, sort of women in their sort of early 40s, is that they get mood disturbance, particularly premenstrual syndrome type symptoms, which they maybe never had. They may have had them mildly as a teenager, but actually for the rest of their life, they've not had PMS. And then suddenly they get emotionally very overwhelmed just before their period starts. And we're beginning to see a pattern of that. And that sometimes may be the first presentation. And for some women, PMS can be really impactful. And, actually trialing HRT or having that discussion might be worth doing.
How interesting. That's really, really interesting. Because some women of mine, they gain weight, the mood swings, are very present. And you can see that they are experiencing, they're going through the phase. And if we look at the MS cohort of patients in the underlying the research, what we know, women with MS, when they reach the phase menopause, we don't see that much of the activity in relapses, but what is prevalent is a progressive nature of this condition. So that's a bit of a concerning. And what we know from starting HRT, the symptoms of MS, we think that it's sort of the MS overlap with the menopause. Overall, the well-being, the quality of life, people with MS improves. So really, I think more and more clinicians who work in MS field, MSologists, neurologists with special interest in MS, they do tend to recommend HRT for menopausal or premenopausal women. So I think working in it, as you mentioned, in collaboration with the primary care and secondary care physicians is our task, is our goal, ultimate goal, to sort of establish that unique personalized care to individual, a woman that comes to see with loads of symptoms yourself, and you then try to find the sort of the solution. But I guess there are some probably side effects and the careful selection of women that goes on the HRT medicine. So maybe I wonder if Katie, you could cover a little bit how do you select women to go on the trial of the HRT, are there any concerns or worries, any sort of cancer history or some coagulation problems, some blood disorders that...
Great question, Agne. Thank you. And again, I think that sort of comes a bit under one of the mythbuster the areas, as I think more traditionally HRT was a worry for some women around the risk around breast cancer. And I guess to talk through that a little bit more, I mean, 1 in 7 of us have a lifetime risk of getting breast cancer, just for being women. Our biggest risk factors being female and increasing age. Now, breast cancer does play a slight increased risk there, but it's modest at best. And we know that other lifestyle factors like obesity, excess alcohol, smoking, eating the wrong foods, not doing enough exercise, actually they probably play as much role or even a bigger part than the HRT in terms of risk around breast cancer. So for the majority of women, HRT is incredibly safe. That would obviously be down to individual discussion with the GP, but it is important to flag up for the majority if it would be safe. There's a different number of formulations of HRT, and there are some oral products which may be less suitable for people who might be at slightly higher risk of blood clots. And so I guess there may be a certain population of patients with multiple sclerosis who, because of that aspect of their illness, may be more sedentary. And so the newer products, the transdermal products, which don't incur an increased risk around blood clots, would be the safer option for them. But I think I'd want to round that up with the majority of people, there's probably going to be a formulation that we're going to be able to sort for them.
Wonderful. Are we finished with the misconceptions? And I wonder if there are any other very common in the community misconceptions that we want to reveal and say, well, actually, it's not true. let's look from another angle.
I mean, I think one of the big questions we get asked, and we're seeing a bit more about, is testosterone prescribing in women. And again, there's definitely a role for it for some women, but women have to be on a standard HRT preparation, and we want to know that their estrogen deficiency symptoms are controlled, and they are particularly sweats and joint aching. Testosterone plays a role. At the moment, it's unlicensed for use in women as a drug, but for some women, if they have persistently low libido on standard HRT preparation, it could be considered. Now, because it's an off-license medication, lots of GPs and doctors are not confident in prescribing it. And I think often testosterone is a specialist discussion because of its off-label use. For women who can have it, it can be helpful. And I think in my practice, and I know in Katie's practice, we tend to see for women who get started on testosterone, where they have blood levels initially to see if they've got lower levels of testosterone. If they have a deficiency and we feel that their libido is low and it may be beneficial, then they can have a trial of testosterone, and it can take 3 to 6 months to reach its full effect. But there has to be some awareness of kind of, I guess, risk and benefit that you're trying to achieve. We do get lots of women coming in asking about brain fog. Does it help mood? Does it help energy? Probably it may do, but at the moment the study data is not there to suggest that we can prescribe it for that. And I think in practice of women that we use testosterone in, about 50% of women find it helpful for those women we start on it. And for some women, it is really beneficial. But likewise, for half of women, they don't notice any benefit on it at all. So we stop it and they just continue on a standard HRT preparation.
Katie, I'm very much aware of the estrogen and the power and the preventative effect on the bone health living with menopause, and in general for women who are within the age of the menopause. What the role estrogen and HRT plays in prevention of the bone health?
Yeah, great question. So we know that, as we said, estrogen has a multifaceted role, and part of that can be in bone health as well. it has a protective and reformation effect on our bones. We know that as women, we have a 1 in 2 lifetime risk of fragility fractures. So the bones becoming broken related to the natural thinning of the bones. If we go into a menopause below the average age, so at 51 or below, then we'd be aiming to try and maintain that estrogen to help maintain that bone health. So generally what we would be advising is, irrespective of menopausal symptoms, we'd be wanting HRT to keep your bone strong and actually your heart healthy as well, if we're going into an earlier menopause.
Wow, so important, not just for your hormones and to general wellness, but for other body structures like bone and your heart, that estrogens play the role as a prevention. That's really powerful to hear that. Really, really interesting information that you just shared with us. Wonderful. So it's good to know that the hormones are available. And if our bodies are not producing the level of the hormones, there is a replacement. And the careful consideration and selective approach to individual is the key. And working with your own GP doctor and your MS specialist who could advise in terms of how much of the flare-up is from MS and how much it could be attributed to menopause is the art of medicine. And I guess communication between the physician and the patient is super important here. But moving away from the chemicals and the hormones, are there any strategies managing menopausal symptoms, maybe with some sort of lifestyle advice would you share in your clinics, and could you share here in during this episode? What do you recommend for that emotional and mental health and physical health living with menopause? Maybe Katie?
Yeah. So I completely agree. So and I know that Kirsty would as well, that our lifestyle measures really should be the grounding of our good menopause care. For I guess the time when we're suffering with our significant menopausal symptoms, but also postmenopausally, we're going to live about 30 years of our life, about a third of our life postmenopausally. So it's going to be about our midlife is about the time to consider how best we are going to be living those lives now and for the future. So regular exercise, weight-bearing exercises in particular are going to be very important from a point of view of bone health. Eating well. So we know from menopausal symptoms are generally worse. So vasomotor symptoms, those hot flush symptoms, are going to be worse with sugary foods. If you're having a whole food plant-based diet, you're going to get better response to the symptoms. Likewise, if we're removing triggers like alcohol and caffeine, they're likely to have a benefit on our hot flush symptoms. There's some really excellent supportive measures from a mood and mental health point of view. And there are now specific talking therapies, CBT for the menopause. We're really lucky in Devon that we have that facility available. Patients are able to self-refer into that. And there's good evidence behind that for support of anxiety, mood, but also hot flushes. So there's an awful lot of things that we can do for ourselves.
Wonderful. And Kirsty, do you have anything to add? Are there any specific guidelines in your mind that you share in your clinic with your patients to enhance that wellness living with menopause?
I think, a lot of what Katie covered are the kind of key sort of eating well, living well. Sort of strength exercises, yoga and Pilates are really helpful. I often find with women going through the menopause, they're kind of the sandwich generation. They're often caught between, children that are kind of a bit older than toddlers, often teenagers with their stresses that they've got. You've often also got parental, kind of older parents stress. You've often got work stress. There's lots of factors that impact. And, clearly if things are stressful and then you've got hormonal changes sort of underlying that as well, stuff can get quite overwhelming. And I think being kind to yourself, making sure that you take time as much as is possible to just factor that in and realise that actually there may be external stresses that you may not be mindful of. I have to say I quite like mindfulness as a tool. And I find that certain mindful techniques can be helpful. Particularly see quite a lot of panic occurring during the menopause. So interesting, driving anxiety is something that, so it's not really documented, but I get lots of women saying, I really don't want to drive. I find it really stressful. I want to avoid going on the motorway and I don't know why I've always driven. And there's clearly something that switches, and that anxiety can be managed through mindfulness. And particularly techniques such as sort of dropping anchor and that sort of controlling that panic. But clearly it has to be practiced to the point where you're not panicking, to try and make sure that you can use those techniques. So looking at anything that you may feel is helpful, but mindfulness is definitely a really good practice to use.
Yeah, I'm very much a huge fan and advocate for mindfulness, as everyone else knows. So yes, I think it's really that wellness that you bring into your day-to-day living. You don't need to wait until the menopause starts. You start living healthy in your mid-age. Even if you're young, if you're 18 years old, 20, if you're young women, please do look after your beautiful body, because your body is going to thank you. And, start these practices, CBT and mindfulness and meditation. You don't need to be very formal with this process. You start with washing dishes and being present in that moment, focusing on the washing dishes instead of going in that sort of circle of the thoughts, which sometimes you can't change. Just, your mind is just in the circus of things. But learning the technique, knowing your body, listening to the signals, why we're listening to the car's dashboard, the lights that comes on about the tires, about engine, we're sort of more proactive and reactive, to that sort of a dashboard light rather than sort of what our bodies are like, are we thirsty? Are we hungry? Have we slept well? Are we looking after our mental health, where we are in this space, in this busy life? So really bringing that attention and awareness into our bodies and putting the strategies in place whilst you're well, before you get unwell, before you get into the menopause, starting practicing. And whilst you're experiencing, it's never too late to live healthy, because it's such a powerful way of helping with your symptoms. And not just menopause symptoms, it's equally very powerful and effective living with MS, because we know that exercises and exercise program is modifying trajectory of the condition of living with MS. It can help to slow down the process of the progression, to alleviate the symptoms, improve the fatigue level, improve the cognition, improve the emotions. So really, we all the ways go back to the healthy living, healthy lifestyle, and meditation and mindfulness and cognitive behavior therapies. This is really important. And we three of us, we just agree on this. There is no way. Just do these changes if you haven't started as early as you can. But I'm just very much aware of the, women, being a woman, it's a lifelong experience. And I wonder if the long-term health consideration, should we be aware of the postmenopausal issues with our health, and how regularly should we check and get screening? How long should we be on the medicine and hormones? Is it lifelong? So maybe Kirsty, you could comment a little bit around postmenopausal and what awareness should we bring into monitoring our health?
Yeah, so I think there's important kind of screening programs that women should be involved with, such as cervical smears. Hopefully, they are already linked in with those. I think one of the key things with smears, particularly for women who are probably postmenopausal, is it can obviously be uncomfortable if you have vaginal dryness and soreness, and having a speculum put in can be the last thing that they want to have done. And clearly that can happen in the perimenopause as well. Vaginal dryness is a real kind of cause for women not going for a smear. So again, if you think it's going to be uncomfortable, speak to your GP about getting some vaginal estrogens to use for a month before. I have to say our practice nurse colleagues are amazing at identifying this and getting it sorted. And often they are the ones going to see the GP and talk to them because it's clearly been really uncomfortable. So anything that can make a smear more comfortable is definitely a positive. Mammogram screening. So women will get picked up into that at 50 if they've got no kind of family history of breast cancer. And it slightly varies. Their first mammogram will probably be between the ages of 50 and 53, slightly depending on where you are in the country, and where you're kind of pulled into that. And that will go on until the age of 70, and that's a mammogram every 3 years. It clearly doesn't take the place if you find a lump or a bump or something abnormal in your breast. You must see your GP before the screening. But screening is helpful, and it does pick up kind of concerning changes. And then I guess from a sort of woman point of view within general practice, there are kind of annual bloods or sort of bloods every couple of years looking for diabetes, looking for lipids. So checking cardiovascular risk, checking your blood pressure. There is more and more evidence coming out about cardiovascular risk in women being different to cardiovascular risk in men. A lot of the data previously has sort of extrapolated out that probably it's very similar. Actually, that isn't the case. And I think we sort of need to be aware that women are making sure that their heart is healthy, as well as having kind of checking they've not got diabetes, checking their lipids are fine, checking their blood pressure's okay. It sort of stems from that lifestyle choices as well. And checking that, they're eating healthy, exercising regularly, drinking within the recommended limits. All of those are really helpful for moving forward with health. Katie, can you think of anything else that I've not thought of?
So I think you've covered it beautifully, I have to say. I think I would highlight the vaginal estrogen, as you already had, again, because I think that is something that we know is overlooked in the general menopause population. But I do think as well that in patients with multiple sclerosis, where I appreciate there is the overlap of symptoms, and it's very common, and certainly the patients that I've had, sometimes there can be a consideration that symptoms are related to the MS, or and so we know that vaginal atrophy, the frequency of needing to go for a wee more frequently, and we call that sort of genitourinary syndrome of the menopause, that is down to a low estrogen state, and we should be asking that regularly as GPs, and also I guess as the hospital doctors as well, to make sure that we are getting the adequate treatment there. I think there's an old statistic, and I think it's a lot better now, but 70% of women over 70 will have significant genitourinary syndrome in the menopause, and only 7% get adequate treatment. That's got to change.
Yeah, it's a very low number, isn't it? I'm just thinking about also from sort of an MS perspective, a lot of women, in particular in progressive stage of MS, they have increased spasticity, increased tone in the limbs, and getting a smear test is another sort of a challenge for these women. And I think, again, working with a neurologist, getting the spasticity or spastic clinic specialists who can provide advice with systemic medicine for spasticity, or local Botox injections to help to sort of undo the intensity of the legs that cannot be spread and cannot physically women have a smear test. So I think that's also important for more disabled women to have the adequate care, which is,
yes.
It's super important, I think.
And I would say that actually we definitely don't talk about vaginal dryness enough. It's a really, really common symptom. Yeah. And actually for lots of women, it's one of their more impactful symptoms. And until we start asking about it, and I think because it happens really slowly, women don't notice it that much. It's something, particularly if women are not overly sexually active. We find that I don't know, that the vagina gets drier, they get a bit sore, they get a bit itchy, and they just don't really think about it. And it is really, really key, because even for women who struggle to put in vaginal pessaries, it's quite fiddly putting in vaginal estrogens. There are options such as a sort of estrogen ring that can sit up into the vagina that could be changed every 3 months. So for those women where actually it's really troublesome, they've got really bad symptoms, but they can't put in something, it's really key to speak to a GP and discuss what your options are.
Absolutely, like manual dexterity. If some women can have weakness in the arms, in the same way with the self-catheterization, and there are options, an alternative way of getting help. And if you have a dry vagina, a lot of discomfort in your genitals and during the or after immediately the sexual intercourse, or you have some recurrent bleeds as well, right, Kate and Kirsty? What are the symptoms to look for to see whether you have a dry vagina or not? Is it so obvious that it can be picked up, or there are some subtle things that could be a beginning and you require some help immediately to improve your quality of life?
I think I would say, to use Kirsty's words again, it creeps up, and it's really important to highlight that to women. People can get itchiness. It's quite common that people will think they've got thrush and they'll be applying some Canesten cream, and they'll be doing that regularly. And that is acting more as a sort of almost an emollient, and they might get some resolution of symptoms related to that, but actually that's not the issue at hand. So they can get pain, they can get itchiness, they can get vaginal dryness. They may find that they're going for a wee more frequently. In turn, they may be finding that their sex drive is going down, understandably so, because they're feeling uncomfortable when they're having intercourse. So it can cause a sort of multitude of symptoms. It's important that we ask, because people are not going to tell us. So I do think it's something that should be as a standard part of the menopause questions that are there. And there's a lot of things that could be done about it. We've talked a bit about vaginal estrogens, but actually there's also non-hormonal methods that can be used, vaginal moisturizers. Simply, avoid using some of the soaps, bubble baths. All of that will play an impact. And I don't know about you, Kirsty, but it's almost one of the most rewarding parts of my menopause consults can be finding this woman who's been suffering in silence with these symptoms. And there is so much that we can do.
I definitely agree, Katie, that actually sort of impact and kind of management is really rewarding, because women have suffered these symptoms for years often by the time they come to see us. And I can imagine that doing self-catheterization with soreness down below, it must be horrendous. And I think until we start the dialogue going about it, it just doesn't, things don't change, because people don't really talk about their vagina very openly. And I think particularly amongst the MS population, where some of them have some really challenging disabilities associated with that actually just starting simply talking about actually how are things, with your vagina and your vulva, and actually is there anything we can do to make you more comfortable, is a really great place to start.
That's it. I think we have to normalize our being a woman.
Yeah.
And don't be shy to express whatever is happening, because this part of the body is so important. This is the most important organ in our body. Then we can add the hormones and everything else, right? This is the way it is. And I think, and that's our main focus, being women, being proud, being women, and experiencing every challenges that may occur. But then if you look carefully and you're mindful and you're bringing that awareness and attention to your body needs, you actually can always find the solution and help yourself and improve your quality of life. And as you know, if the menopause is well controlled, your MS symptoms are going to be well controlled too. So there's no brainer not to bring these topics during your clinical consultation with MS specialists and MS specialist nurse, with your own GP, and finding that common solution that will nourish your body, will help you and improve your quality of life. So the final words, Kirsty and Katie, of encouragement and advice for women embarking on their menopause journey. Any ideas that you would like to share?
I mean, I would I would say if you're wondering whether you're perimenopausal or menopausal, then speak to people. It's often not a question asked. Patients often have to come forward. People often have to say, I wonder, and then the discussion often happens. But I think there's lots of information out there. There's good, I was just trying to think, some good patient resources. Well, hopefully this podcast has been helpful for some people to kind of understand a few of the challenges. The NHS website's a pretty good place to start. And then, I mean, there's apps and there's lots and lots of information. And I think any time that you do wonder whether you've got menopausal symptoms, do raise it, because the sooner you raise it, the sooner it can be discussed. And then hopefully a kind of help can be given. But clearly it's more than just hormones. It's a sort of full lifestyle option of looking at exercise, looking at healthy living. Hormones can be helpful.
Yeah, I agree with Kirsty. So it's the end of one part of our cycle and onto the next step in our life, and it is an opportunity to sit back and reflect where we are and how we want to be. I think education is power, and I would support people taking that chance to read up and to ask that question, as Kirsty has said. I think if you're finding that you are struggling, you're needing to get more support, you feel that you're needing more expertise, then you can ask to speak to a GP in the surgery who has more of an interest in women's health. So it is just maintaining your power and empowerment.
Wonderful. And if you are a patient of Kirsty and Katie, you are the most luckiest women in this world, because you got specialists very close to you that you can always openly share your concerns. In the meantime, there are so many other specialists in the world that you may think to connect. Let's thrive as a woman. Let's have a good quality of life. Let's have a good sexual life. Let's bloom like flowers and enjoy our lives as a woman. So thank you, Katie and Kirsty, for sharing your invaluable insights and experiences with us today. To our listeners, we hope this episode has shed light on the complexities and beauty of the menopausal journey and women's health. Remember, every step in this journey is part of our unique and empowering experience of being a woman. Thank you for joining us on the Be Well with MS podcast. If you enjoyed this episode, please share it with someone who might find it helpful. Stay tuned for more episodes where we explore health, wellness, and living life to the fullest. Until next time, take care and celebrate the wonderful journey of womanhood. Thank you, Kirsty and Katie.
Thank you.
Thank you. No, pleasure.